Hi, my name is Dr. Adrian Delaney at Clay Platt Family Medicine, and I'm going to talk to you about smoking and smoking-related issues. At Clay Platt, we believe that smoking is one of the highest risk factors for heart disease. There is over 400,000 smoking-related deaths a year in this country, and so we think that is a very important health topic to bring up on a regular basis at our daily office visits. With smoking, a high percentage, almost 60% of people before the age of 18 attempt some type of tobacco product, whether that's smoking tobacco or chewing tobacco. And usually those attempts become a peer pressure issue. And once those attempts have started, you get multiple attempts from various situations as a teenager, and then you get addicted. The biggest issue with smoking is nicotine. Nicotine comes in the tobacco, but it also comes in chewing tobacco. I don't want to eliminate the idea that chewing tobacco is safe at all. But the nicotine, once it gets into your system, creates a significant risk for multiple health issues. The biggest issue with nicotine is its addictive properties. We have nicotine receptors in our brain that we actually upregulate when we start using nicotine, meaning we get more of them. So your body is looking for what I call a fix of nicotine once you become addicted. Therefore, it is understandable as to why it is so difficult to quit smoking. Once that happens, your body starts to break down multiple things due to that nicotine in your system. Things such as the vessels in your heart or your brain, the vessels in your eyes or your kidneys, the vessels down in your legs. They all start to create a bunch of inflammation due to the nicotine, and eventually you start to create what's called plaque in your vessels. On down the road is when those things give us the health issues that are extremely common in our society. The most common cause of death in this country being heart disease and heart attacks. Nicotine is the highest risk factor for heart attacks. We also know multiple cancers that are related to nicotine and increased incidence, including things like esophageal cancer and stomach cancer, bladder cancer, and quite clearly everybody associates lung cancer. Lung cancer comes from both nicotine exposure as well as the direct toxins from the smoke. With chewing tobacco, you get the same absorption of nicotine in the system, creating the other risk factors, but also localized risk factors in the mouth, the mucosal membranes in the mouth and the throat. So the highest risk factor for throat and mouth and neck cancers is chewing tobacco. So we believe it's a big issue in this country. We know that many Americans are trying to quit smoking because they're either aware of the risk factors or they know somebody that have died from tobacco-related issues. But we also realize that quitting tobacco products is extremely difficult due to its addictive effects. What we try and do at Clay Platt is spend the time and effort to come up with barriers to quitting smoking, whether that's social barriers or work barriers, stress barriers, whatever might be driving you to continue to smoke, short of the fact that it is highly addictive. Once we break down those barriers, we can offer multiple treatment approaches, whether those are natural approaches, potentially nicotine supplements such as gum or patches or prescription inhalers that have nicotine in them, or prescription medicines. Several medicines on the market that are very effective at helping people quit smoking. Certainly we take every situation and approach it in the manner that we see fit. Not everybody's ready to quit smoking, and I don't push people in that direction until they are ready, because it can become more frustrating for people if they try and quit and it's not time. So we try and work with everybody on all situations as far as nicotine goes. The other interesting piece of information is that trying to quit smoking on average takes 5 attempts. So it can be very frustrating for the first person or for the first attempt to try and quit, but I encourage all my patients to understand that it is extremely difficult to do and you have to keep trying.